Welcome to the Lighting Your Way podcast. I'm your host, Guardian Nurses founder, Betty Long. During season 3, we'll be delving in deeper to the amazing lives and stories of nurses and other healthcare professionals from around the country. We'll also be talking with a few of my nurse advocate colleagues at Guardian Nurses. You'll get a behind-the-scenes peek at the healthcare system, as well as get advice on how to get the best care when you or a loved one is a patient. Many studies prove that getting a second opinion can often change the diagnosis and the treatment plan, sometimes in as much as 25% of cases. In the last couple of years, second opinion services, like the one we'll talk about today, have grown in the healthcare space. These services are typically private pay, meaning they are not covered by health insurance, but for many patients who can afford to use them, they can be life-changing. Today, we talk with Kirsten Grueter, nurse practitioner and director of clinical operations at Best in Class MD, one of the newer companies offering second opinions, which was founded by 2 orthopedic physicians from the Hospital for Special Surgery in New York. HSS, as it's known, is the oldest orthopedic hospital in the U.S. and is consistently ranked as the top orthopedic hospital in the country. Let's start our conversation with Kirsten. Kirsten Grueter, welcome to Lighting Your Way podcast. Thank you for taking time to join me.
Of course. Thank you so much. I'm so happy to be here.
Yeah, it was great that we connected last week, and you are both a nurse practitioner and you have a little bit of an entrepreneurial spirit in you. So we'll talk about that a little later. But first, I want to talk about your nursing career. So give me a little background. Tell our listeners a little bit about you and your career.
Yeah, sure. So I went to nursing school at Boston College, up in Massachusetts. I don't know what it was that drew me to nursing specifically. My mom's a social worker. My aunt's a nurse. I feel like it was kind of, in the family a little bit. I feel like mostly it was that science was my favorite subject in school growing up. And so I think I gravitated more towards math and science focuses. And I always really liked orthopedics. I thought that, I was an athlete growing up. I didn't play any college athletics, but I did play, all through my adolescence. And I thought orthopedics was really cool. So when I graduated from nursing school, I took a job in Manhattan working at Weill Cornell on the, operating room floor there. And it was actually the entire orthopedic department that I was working with. So I was around orthopedic surgery sort of immediately as a nurse. And then I went back and got my nurse practitioner at NYU. I stayed working throughout the whole time. And I ended up staying at the Hospital for Special Surgery for close to 7 years. Yeah, it was great. So I saw a lot of different orthopedic patients in all different departments.
That right, and Hospital for Special Surgery is kind of like the place to go for orthopedics.
Yes,
right?
Correct. Yeah, it's been rated number 1, I think, for 11 years in a row by U.S. World News Report.
Wow. So when you were growing up, did you have any injuries? Is that why you?
No. I thought that of all the different fields of medicine, I don't know. I found it to be like a little bit more happy than some of the other, it was like, oh, you have an injury and now you're going to see this doctor and it's going to be fixed. You know what I mean?
Okay,
it wasn't,
right.
It wasn't sort of this longer term care plan typically, although there are situations where that is the case, but for the most part, it was a little bit, broken, fixed.
Right. That's true. Good point. It's why a lot of nurses go into labor and delivery because it's happy, usually, typically. Right. And that's the beauty of nursing is that there's so many opportunities for different specialties.
Totally.
That you can, get into whatever you need or whatever attracts you. So during the stint at Hospital for Special Surgery, it sounds like from last week's introduction to you that you had, under the tutelage of one orthopedic physician that you started to work with. Was it Dr. Lane, I think?
Yep, Dr. Lane. Yeah. I worked for him for a while.
And on that research team, what were you doing?
Dr. Lane is a pretty impressive researcher. And he's, when I was working with him, he was honestly towards the end of his career. So he had, developed quite a reputation amongst the sort of research group. But he was doing actually NIH grants. And so one of the projects that we were working on was pelvic fracture healing. And there's a drug called Forteo at the time. There's a few different iterations of it now, but it's an anabolic agent that's used to actually augment fracture healing. So it increases fracture healing. And typically pelvic fractures are, a geriatric type of fracture. So, you have what they call a ground level fall, and that will result in a fracture where you don't need surgery, but you need protective weight bearing for a period of time. And we did a study with the NIH where we would take a group, it was a double-blind study. We would take groups of patients and either put them on Forteo or a placebo, and to look at how quickly it would increase the healing, because the drug currently only has a label with the FDA for osteoporosis, not for fracture healing, even though we know that it, anecdotally and in the literature, I think it's Japanese literature that supports the fracture healing. So we were trying to help get the FDA to grant another label application of it, because it's a really expensive drug. And so people on Medicare can't necessarily afford it if you're, if it's not considered, if it's considered an off-label use, you have to pay out of pocket for it typically. So that was one of the main ones that I was working on. But honestly, he had at any given time like 8 or 9 projects going on, and he had a big research assistant team. A lot of kids that are considering applying to medical school after college, they'll take a year or 2 off and do research and then go to med school. So we always had some students in the office, which was fun.
Interesting. Okay. So that makes sense. So you then left, and in your current position, you're at Best in Class MD.
Yeah.
Tell us a little bit about, you're now director of operations, right?
Yep. And clinical operations specifically. So really, spearheading sort of all of the clinical strategy and, which groups we want to be working with. And so, yeah, another one of the physicians that I worked with at HSS, who is also an orthopedic surgeon, he founded the company. And when he was, telling me about it, I thought it sounded like a great opportunity. And I worked sort of part-time for a couple of months just to make sure that I was going to like it. It was a bit, big change leaving leaving the clinical field to go and work on, sort of more of a business kind of back end type of role. But I did that for a couple of months, loved it. And then I left about a year ago to join them full time.
So when we'll talk about I mentioned entrepreneurial spirit, but what attracted you to working at Best in Class? Like to your point, leaving the hospital after all this research, and you were at the premier orthopedic hospital. What made you make the leap?
Yeah, it's a good question. I mean, to something that you said earlier is that it's kind of the beauty of nursing is that you really can do so many different things, with your degree. There's a million different jobs that you can have. And I think, even until I graduated my graduate program, I didn't even realize this whole other world of job opportunities outside of the hospital setting or the outpatient setting. And, I think I was just ready for a new challenge. I think the patient population that I was working with at HSS, which was, all specifically orthopedics, but towards the end, it was a geriatric patient population. It was a lot of geriatric fractures, things like that. I think I was just ready for a change, and I didn't really see a lateral move to another clinical area as super exciting or appealing. And I also didn't really see hospital administration as super exciting or appealing.
Why not, Kirsten? I can't imagine why during a pandemic that you wouldn't see that.
I actually, worked on a project or two because I was like, maybe I would like it, maybe it just seems boring. No, it's boring. I tell you, it's very dry.
Right.
So I was like, that's not necessarily it. And it just, I believed in the founders of the company. I think that was one of the biggest things. I really believed in what they were trying to do. I believed in their sort of ethical approach to medicine, and just their energy levels and their, belief for the changes that we could make in sort of this expert medical opinion world. And so
Okay.
I was like, I'm young enough that you can always kind of go back to these
Right.
nursing jobs too. So I felt like that obviously, played a big factor into it, that I
Right.
was kind of like willing to take the risk, so to speak.
Good for you. Good for you. To all those points that you made, but I think it's again speaking to your spirit. So tell us about tell us about the service. Tell us about the two founders. Talk a little bit about Best in Class.
Yeah. So one of the founders, Dr. Machuku is his name. He's a sports medicine attending at HSS, and he worked actually for a period of time during his residency at another expert medical opinion company. And, as your audience probably knows, second opinion companies, expert medical opinion companies there's many of them, and they,
Yeah.
take up a big part of the market share. This is not sort of a novel concept, but he really saw a lot. He was very aware of the inner workings of the company and saw a lot about who was doing the reports, how the reports were being written, what the actual, clinical substance of those reports were. And he just saw a lot of opportunity for improvement. So this predates the pandemic, significantly. This is many years ago.
Okay.
And so the idea for this startup actually was born out of his experience working for another company in the space. And then with the pandemic, I think the biggest hurdle about telehealth and telemedicine services was actually physician adoption, and not necessarily patient adoption. I think it was both, but the physician adoption was, arguably a harder nut to crack, because some of these very good physicians just did not see it as, worth their time. They didn't need to do it. They didn't want to do it. And with the pandemic, really, that was the main opportunity to recruit them all and get them kind of bought into this idea.
Okay.
And so that was sort of how it started. And the other founder, Dr. Williams, he is another sports medicine surgeon at HSS. He's a little bit further along in his career, and he is actually the team physician for several of the New York teams, the Nets and the Liberty and the Red Bulls, and he takes care of the Olympic basketball teams, USA basketball for men and women. So he was in Tokyo for the Olympics, and he has all kinds of pictures with Kevin Durant and holding gold medals. Really cool.
Does he have those in his office? That's kind of intimidating.
Yeah, he does.
She's like, "Gee, doc, I only have a sprained ankle. Sorry." Yeah. Right. Right. Kevin Durant's got a bad foot, but I only have a sprained ankle. You'll be fine, right? Yeah. And isn't that the thing with orthopedic doctors that I've always felt when I've gone to them? It's like, I'm not a professional athlete, but please treat me as one, right? Don't treat me as just a weekend athlete, right? Like, you'll be fine. Stay off of it. Mm-hmm. So they saw an opportunity. They saw an opportunity to do it better, right? So how do they do it? What's the process to get a second opinion?
Yeah, sure. So, I think it's becoming at least a little bit more and more well known that, second opinions are valuable for a lot of different reasons. And it's less of this really offensive action for a patient to take to get a second opinion. I think most physicians understand that that's a very reasonable step in the medical decision-making process. And it's a little bit more supported on a general level. And so, their main view of what they could improve upon was the quality of the MD network and who actually is writing the opinions, because getting a second opinion from a doctor that's equal or less qualified than the original doctor that you're getting the opinion from isn't necessarily helpful, right? You're getting it's a different opinion, but it's not necessarily a better opinion. And sometimes that can actually just make everything more confusing, because you're not now sure which plan to follow. And if one is not necessarily better than the other, you're not in a better place about what to do for your care. So that was sort of the main focus that they saw an opportunity for. And so our network is invitation only. And so the recruitment and identification process for who we invite to be a participating physician in our network is pretty rigorous and, is kind of the core of what we promote to our clients and what we promise to our patients. And so we look at 5 different things, and, this is, not the strictest criteria in the world, but these are kind of our loose guidelines. It's the institution that the physician currently practices at. And it's important to note that all of our physicians they work as independent contractors with Best in Class MD. So they maintain a primary practice within wherever it is that they work. And I think that's important because, I think that the physicians that are actually actively practicing, performing surgery, seeing patients in person typically have the best recommendations, right? You don't want a doctor who doesn't see patients anymore giving you advice on what to do, because I think it can be a little bit removed from reality.
Thanks for nothing.
Yeah, right. So we look at the institution that they practice at. We look at where they did a fellowship training. Everybody is fellowship trained on our network. We look at where they did a residency training, where they went to medical school. And then the final thing is the number and quality of academic research publication. So we typically find that, the best physicians and the physicians who have sort of the latest and greatest toolbox are the ones contributing to academic research and, kind of pushing the field forward in that way.
Is there any consideration? I know we often coach our nurses at Guardian Nurses about outcomes, about volume, right? So the physician who's doing 20 knee surgeries may not be the one you want if there's another one doing 500.
Right.
So is there any consideration of volume, or do you just assume that because they're in an academic health center that's kind of given?
Yeah, we don't look actually that granular at the case volume and things like that. Not to say that we won't in the future, but just currently right now we don't. But, I think not all of our doctors work at academic institutions. Most of them do, but we definitely have, private practice physicians as well. Typically they go from academic institutions to a private practice. That's kind of like the trajectory. But we, based on the qualifications, we know that every doctor is hitting X number of procedures per year. So this is kind of, what they're living and breathing is orthopedic surgery day in and day out. So
right. Practice makes perfect, as we say. Are there any issues getting the physicians, like, I guess I want to say double dipping, right? The concept of double dipping, like I'm working at, Cornell or HSS, and I'm working on the side for hospital, for Best in Class MD. Is there any conflict of interest going on?
Yeah, that's a great question. And it's something that is top of mind when I'm, speaking to prospective doctors. And so it's actually all based on the fact that BICMD's services are considered educational encounters. And so everything that is discussed or written or communicated, through a Best in Class MD consultation is for educational purposes only. And so the tool is really meant to be a decision-making tool. You're talking to a physician who has, very subspecialized expertise in whatever it is that the problem is. And they're saying, based on my experience, based on my research, based on XYZ, this is what I would do. And then from there, you can make a decision about who actually is going to follow out that treatment plan and take care of you. So if you want to change providers, we can either help with a referral to another physician in your area, maybe at a center of excellence, somebody that is, maybe part of the network or 1 degree separated from the network, something like that. Or you can actually see the BICMD physician, but when you go and see them in their office, it's as if you're a regular patient. It goes through your regular insurance coverage. You become a formal onboarded patient. You're seen through the institution. So BICMD is kind of just the referral process and like a stepping stone in the next step of the plan of care. And so because everything is educational, a lot of the institutions have no issue with the physicians participating. And actually, it ends up being, and a lot of times, a good referral source for the
Yeah, I was
institutions,
just
because
thinking that. Yeah.
yeah, you can screen, who is a good surgical candidate or not, and the client satisfaction is a little bit higher because if you don't need surgery and you don't need to make a trip to the hospital and you don't need to, take a whole day off of work to do, the whole doctor's appointment, which it always ends up taking an entire day for some reason,
Right.
even though you get 10 minutes with the doctor, then, you've saved kind of an appointment that might be better for an actual surgical candidate. So the institutions typically buy into it when,
That's
when
interesting. Okay.
Mhm.
Now, you mentioned the big bad insurance companies. So let me talk a little bit about that. I do not think insurance companies pay for this type of consultation. Is that correct?
Yes, we don't participate with any insurance companies. I think that insurance companies that pay for a second opinion, they want you to get the second opinion through the doctor that they have hired, typically, like an internal group at at an insurance company. So, um, yeah, that's typically the answer. And I think there is something to be said about not wanting to get a decision from the organization that is paying for your surgery, because at the end of the day, that the motivation for that is always going to be financial, right?
Yeah.
And so they're always going to recommend typically the cheaper option, which sometimes is conservative care, sometimes not, but I think it introduces a lot of doubt for
Mm-hmm.
the patient when you're getting an opinion that's facilitated by the person that's paying for the operation, because in the back of your mind you're always thinking, well, of course they're going to say no because they don't want to pay for it.
Right.
And then, the confidence level that you need going into any major medical decision making is so crucial. And so if you're not confident about what it is that you're embarking on, automatically you're set up for failure, because you're not gonna, your perspective on the entire situation is just gonna be poorer when you're not confident.
Yeah, we we often say follow the money.
Right.
So if there is, and I don't understand why they wouldn't pay for. I will say that insurance companies, at least the ones that we work with, they're national. With a lot of the patients that we have, they have rich benefits. And what's always interesting to me is that patients still have the perception that is this second opinion going to be covered, as though they wouldn't cover it when they're insured. And it's like, no, it'll be covered. And
Right.
part of the charm, and I think you realized this last week, part of the charm is that our nurses can tee up that second opinion with another hospital or another physician, maybe not a nationally recognized one, but somebody who is a different opinion than the one that they just got. And that does help the decision-making process, to your point, right? So it's always better to get two heads. Two heads are better than one, as we say. But I just don't understand, in terms of when you're looking at expert medical opinions, when you're looking at the best in class doctors, those who are, chiefs and have done all the research, that this service wouldn't be covered. It doesn't. Maybe it will be in the future, because it often, to your point, would lend a different treatment plan. And that is, if we were thinking about what's best for the patient, and I know that doesn't always happen in the insurance company, but what's best for the patient might be, right, to have surgery and to have it done by a qualified, doctor who's doing 1,000 of these a day, or I'm sorry, a year. Whoops.
Yeah.
Not a day. Not a day. That would not be a good quality, not quality. So let's talk about, so the orthopedic second opinion, which is what birthed the best in class MD company out of HSS. So we've talked to patients all the time. We've talked on the podcast. We've had nurses come on and tell stories about the value of getting a second opinion. But certainly when it comes to orthopedics, it always feels like that's the sweet spot for getting a different treatment plan, right? Because, spine surgery is not always the best decision, right? It's a 50-50 shot to have a better outcome. So I appreciate that you as a nurse can bring that to the discussion. But I know that you and I have talked about the top 5 things to do before seeing an orthopedic or before having an orthopedic procedure. And one of them is knowing about your condition. Tell us a little bit about that.
Yeah. Yeah. I was going to say, I think your very first podcast episode of Lighting Your Way was the value of a second opinion.
Right. Yes.
So,
thank you for remembering.
Yeah. So, clearly it's, something that has been top of mind in your education to your nurses and therefore to your clients. So it's great. Yeah, we have a little blog post on our website that is meant to be, a resource for patients who are kind of doing their own research about second opinions. And yeah, knowing about your condition is obviously step one, right? And so, knowing that you have the correct diagnosis and the right diagnosis is really, really, really important. And actually, a lot of these opinions where we see the biggest change in the treatment plan or the biggest impact, either clinically or financially, from the expert medical opinion, is when there's a misdiagnosis. And they're more common than you would think. And so having the radiology actual study, not just the report, is really important for specifically getting an orthopedic second opinion, because a lot of orthopedic physicians interpret radiology reports themselves. They're not radiologists, but they have a level of education in interpreting orthopedic exams that is really, really valuable. And so, if you submit your imaging alongside the report, typically there's a lot of incomplete diagnoses. It's not necessarily wrong, but it's, there's this going on, but there's also this that you may have missed. And so getting starting with the right diagnosis is just critical for everything that is to follow. Because if you're treating the wrong thing, obviously it's not going to be successful, and you're going to have a lot of sort of downstream problems from that. So that is step one. And, patients can do a lot of research on a diagnosis, right? As long as you have the right diagnosis, there's tons of, in the world that we live in, there's no shortage. You have to be careful about what you're reading and, where it's coming from and what the source is. Obviously, Dr. Google is all over the place, and there's all kinds of ridiculous information out there. But as long as it's from, a reasonable source, there's a lot that you can educate yourself on before anything.
And I think one of the suggestions or recommendations, I guess, from the blog post is that you should get to know your orthopedic surgeon. And I think that's probably, for us as nurses, we can kind of see behind the scenes. We can kind of get a sense of, what they're like to work with and what's their typical strategy for this and for that. But for a normal everyday patient, how does somebody get to know their orthopedic surgeon?
Yeah, well, you can research their academic research, right? So that's all public information, is, what articles they've published, what exactly the outcomes are. There's all different databases that you can look up to see, kind of reviews on a doctor. I laugh because, getting to know your orthopedic surgeon in the course of an appointment, typically when they're when they're seeing maybe 40 patients in a day and they're kind of running out of the room, it's, you might not get to really know them in the course of that consultation, but there's research that you can do, outside of that. And then typically, I say that, physician's assistants, specifically orthopedic surgeons, typically have a physician's assistant that they're working with who's in their office. They're a great resource for questions and kind of, asking some of the maybe longer answer questions that maybe the doctor doesn't have time for. They typically are just spitting back, information that they hear the doctor saying all day, every day. So you really are oftentimes getting probably the same exact answer that the doctor would be answering. And, I really encourage patients to use them as an educational resource.
That's a great suggestion. One of the things that we talk about a lot at Guardian Nurses is to get a game plan, right?
Right.
You're an athlete, I'm an athlete, right? So it's what's the game plan? What are we going to do? And that is certainly, I guess, the most important piece for a patient approaching some orthopedic injury. So talk a little bit about that.
Yeah. I mean, having the plan, the correct plan, understanding, exactly what to do is critical. And so, if your plan is actually before you've made a decision about surgery or not, or just what your treatment plan is. I mean, we have a couple of things listed on the website. I think before surgery, there's things that everybody can do. Smoking, got to stop smoking.
Okay.
Getting on a healthier diet, losing weight a lot of times with, knee pain, back pain, hip pain. Weight is a big factor in that. And sometimes, if you lose the recommended amount of weight, the pain can actually be resolved just from that alone. Get exercising, making sure that if you're on other medications for different things, diabetes, heart disease, your blood pressure's under control, your blood sugar's under control. All of those things are critical for, having good outcomes for no matter what it is that you're doing. But
True.
those are some of the things to kind of, I think, top of mind before surgery. And then, during surgery, just I think having everything in life I'm realizing is about managing expectations, right? And so if you are very educated on what to expect, this is what's going to happen this day, this is what's going to happen this night, this is the amount of pain that you should be expecting. There's a lot that can be improved from an outcome perspective because you know what to expect, and so you're ready for it. And so I think a lot of that can be resolved kind of beforehand.
Right. And I will tell a personal story. When I had an inguinal hernia, a hernia in my groin, and I just went to the local doctor. And
Right.
this is when I was a nurse, and I just assumed that she knew what to do. She was young, and I thought it's just a hernia. And turns out, she sewed up a nerve in the stitching, and I was having pain, and I had to have it addressed by another attending physician at a large academic medical center because he was the only one that would go in and try that. Right. But I should have, I say that to patients when I'm working with it, don't be afraid. I did it. I didn't get a second opinion, and it ended up not being a great outcome. I mean, it did in the end, but now, so getting a second opinion. Now, let me tell you let's switch to golf, because one of the things that when I was with a patient getting a second opinion, the physician had enough time to bond with the patient about golf. It was like, really, it was like, wait a minute, are we going to talk about the medicine here, the consultation? They were just chattering away about golf, and I was like, okay. So I was really intrigued by you and your three friends who started Grueter Golf. So as a nurse practitioner, who has time to golf? You're busy. Come on. What is this Grueter Golf? Tell us about that.
Yeah, it's been really, really, really fun. So when I was maybe 5 years ago, my girlfriends and I, we just wanted to see what it was all about. We knew a lot of guys, our guy friends from college. A lot of people kind of peripherally. My family never really played, so it wasn't like I grew up, going to a country club or anything like that. But
Right.
we just had an interest about golf and what all the hype was about. Why is it that all these guys go and spend every Saturday and Sunday, for 4 hours doing what is it? And so we went and tried it out, and we just had the best time. I mean, it's very, very difficult, but you have one good shot, and it's like addicting. It makes you want to come back. And so, but it was super intimidating.
Yeah.
Like really, really hard sport. You need all new equipment. You need a brand new outfit. Basically, you need all
right,
these
because the
things.
outfit is important.
It is
right?
important. And there's
Yeah.
dress codes that are
Yeah.
like intimidating and scary, and you don't want to be, dressed inappropriately. And so I think all of those things that, are scary about it, I don't think I would have started on my own, right? The fact that I had my two best friends from college were there with me, gave you the confidence to just be like, yeah, we're going to all go together. We're going to be bad. It's going to be funny, whatever.
And none of them had experience either, right? You were all rookies?
It was all the first time for any of us really playing, which was another critical element to it, because we were all bad. You don't want to start playing with somebody who is good, because they're not going to have a good time and you're not going to have a good time. Right. So, the fact that we started playing, and then as we kind of got going, we were like, why is it that no women really play? Why are we such the minority? When we showed up at that golf course, we were the only 3 girls there playing, besides the cart girl who was serving the drinks, and we're like, looking around, it's kind of weird. And we're like, let's start having these sort of get-togethers once a month. And I was living in Manhattan. One of my friends was living in Manhattan. The other one was up in Boston. We all went to BC together. And we started hosting these monthly gatherings around New York City. And every single month, they doubled in size. So somebody was like, brought a friend, brought a cousin, brought a coworker, whoever.
That's great.
Until maybe 9 months later, we had 100 girls at one of the events. And we're looking around and we don't know anybody. We're like, wow, this is a company, I think. I think we could maybe make this a company. So we started getting a little bit more into the event space. We have a membership. It's all about, providing resources and a community of female golfers, beginner golfers, to kind of connect and sort of explore the game together, and providing that environment that is kind of shelter from the very intimidating world that golf is. And so, now we actually have a podcast called Low Expectations, which is fun. We try to focus a little bit on
speaking about expectations of surgery, right? Low expectations.
Well, the expectations for golf skills are very low. So that's, that's where that comes from. And we try to focus on the LPGA and bringing awareness and fanship to the LPGA, because that's a great product that, not a lot of people really have a lot of exposure to.
Right.
And, just continuing to try to encourage women to get out there and play. I think golf is a great tool for a lot of different things. It's fun, obviously, first and foremost, it's a really fun thing to go do on the weekends, but for, you were saying before, different business ventures and, networking generally, it's a very, very useful skill to have. And you don't have to be good. You just have to have enough confidence to be like, yep, I'm coming out on the golf outing. And, if I shoot 115, who cares? I'm still out there having all the conversations that, that I should be having, because I'm just as qualified to have them as, the next person.
Correct. Right. Yeah. We have a golf team at Guardian Nurses because of the golf outings that we often get invited to. Right. And, so when we interview nurses now, it's like, do you golf?
I love that.
Great. Perfect. And always everybody's like, I'm not that good. Doesn't matter. We don't care. Mm-hmm. We're just having fun, because it'll just be the 4 of you going out.
Right. Right.
So amidst to a tournament, certainly in the building trades, often a lot of men, not that many women. And yet, they always have fun and the guys are great. When you have these events, are you renting a course? I mean, it's got to be hard to get 100 women on the course.
Yeah, we do. We rent it out. So it's like a full shotgun outing. Usually we do it in sort of the late afternoon on a Saturday. Because that's when, we go to public courses, because not everybody is very good. And a lot of beginners, they don't necessarily know the rules yet. And so you got to be aware, of going to a private course. There's typically a lot stricter rules there. And then, going to a public course, at least around New York City, the dress code is very relaxed. So you don't have to, you can tell people, you don't have to buy golf shoes. You can wear sneakers. You don't have to buy a long skirt. You can wear athletic short, whatever it is. And so that's been really helpful. And yeah, we rent it out so that they, it's not taking up the entire day. They can still keep their tee times open in the morning. And yeah, so we do what's called a shotgun. So I'm sure you're familiar. Everybody starts on a different hole. Everybody in the group starts on a different hole, and you kind of just like go in a circle, sort of chasing the group ahead of you. So some groups start on hole 5 and end on hole 4,
Okay.
And yeah, it's super fun, super fun.
And do you have instructions for the rookies, for the novices that come on, or is it just, get out there? Do you pair them with someone who kind of knows what they're doing?
Yes, we do. We have instructions, and the teams are, very thoughtfully planned out. So we play as what's called a scramble. So all 4 people are on a team. And the way that a scramble works is that every person gets to hit the ball, and of the best shot, all the teammates pick up their ball and drop it where the very best person's ball went. So if you have and that happens each shot. So off the tee, you go to the best one. The next shot, you go to the best one. The next shot, you go to the best one until it's in the hole. And so if you have just one person who doesn't even need to be good, but just knows the rules and knows about pace of play and knows about kind of, how to sort of herd the group together, then the true beginner can hit it into the woods every single time, and they'll never even have to use one of their shots throughout the day. So the pressure is a lot lower, right? There's not a lot of pressure to have a good shot because you have 3 other teammates who can have a good shot and bring you guys forward.
That's great. I mean, right, because there is no pressure. And do you keep score?
No, absolutely not. No scorekeeping.
Great.
Yep.
Sounds like a perfect day on the course.
It really is.
Just getting out there to try your best and hit a good shot.
Yeah, it's wonderful.
What it's always intimidated me about golf is just the equipment, right? To your point, I mean, the golf clubs alone. Right. And when I've gone out, I've always gone out with an experienced golfer who'll say, okay, pick the 7-iron and do it this way. Right. And okay, do it this with this. Cause I never knew what club to use because I didn't do it that often. But that's
a big question. What club to use? It's hard. I mean, even I still sometimes don't know what club to use. And because if you're not consistent, sometimes it goes 50 yards, sometimes it goes 150 yards. I don't know. It's unclear to me too.
So you've taken 3 of your friends, and now you have 150 friends that are following you.
Exactly.
You still enjoying it? You still want to grow it?
Still enjoying it. Still wanting to grow it. We're trying to figure out how to make the events, a little bit more self-sufficient, where the 3 of us don't necessarily have to be at every single thing, because it's hard. It's hard with, my day job and, just other life things. So we're trying to see how we can sort of nominate ambassadors, so to speak, to run different events. Because I think the key about it is having consistency in the events, right? You have something to go to on a not every week, but on a consistent basis that gives you sort of the encouragement to keep showing up and keep playing, and you meet friends there. And as soon as you have friends to go with it, it just makes it honestly so much easier to have the confidence to say, let's go out today.
What about are there leagues? I know down here in Philly, there are ladies leagues, evening leagues, right? 9 holes where you can just go after work, and it's to that point, to the consistent outing. Is there something that could be?
Yeah, there's a ton of stuff. I mean, typically the leagues are, if you're a member at a club, and so that,
gotcha.
That's great. But I think it takes a while to commit to, it's really expensive a lot of times to join a country club. And so, you kind of have to know that you love it and know that it's going to be something that you want to do for a while in order to jump on that commitment. But there's a place called 5-Iron Golf, and they have locations in Philly. They have a couple in New York. They're opening in Boston. They're all over the place. They just opened in Seattle, DC, Pittsburgh, all these places. And it's a simulator bar. So you're hitting on a piece of turf with a real club and a real ball, but you hit into a screen that's a simulator. And so it sort of projects where the ball would go based on how you actually hit it. And they have that's where we've done a lot of stuff because, a lot of people are in the city. It's a fun sort of environment to go learn and play at.
Right.
And they have leagues that are public and you don't have to be, a member of 5-Iron. And so we facilitate some of those as well. And that's been really fun for the women too.
And most of the marketing that you've done has been on social media, which has been very interesting, right? You've grown from 3 friends to now 100 and, more than 100 people coming out. That's all been done through social media.
I mean, we have lots more than that now. We've done events in Chicago and Boston and Philly and DC. We're trying to, kind of expand our reach, but yeah, the power of social media is really, it's really been amazing to see. And, you get one person to come and then they tell 3 friends about it. And, so all of a sudden there you have this sort of like spidering effect, which has been great.
I think it's great because I think if I had, if I was younger and there was something like that available, I would have done it. Right. But, there wasn't really there. Well, I knew there were public courses, but certainly the country club courses were not something that I would have thought of. So kudos to you and your friends.
Oh, thanks.
Right. That's the entrepreneur in you. I'm proud of you. Congratulations. That's great.
Thank you.
I just hope it doesn't take you away from nursing. Don't do it.
It won't. It won't. It's a passion project,
Right. And certainly a stress reliever given all that you're going through. So.
Definitely.
So thank you, Kirsten, for joining me again. Thanks for the information. And really, it's been a joy talking with you. Thanks. I'm glad we met.
Yeah, Betty, thanks so much. It was wonderful. If anybody has any questions, I told your team to, anytime you guys want to reach out, I'm happy to answer any questions, help with just, being a sounding board for any patients with orthopedic issues.
And your Best in Class MD website is, what's the URL for that?
It's bestinclassmd.com or bicmd.com. Either one of them will take you to the same page. We have a lot of, like I mentioned, blogs, resources on there about the value of second opinions, some of the doctors on our network, what conditions we treat. And if I can help in any way with any patient, whether they need BICMD or not, I'm happy to do so.
Thank you very much. And happy that our paths crossed.
Me too.
All right. Good. Take care.
Thanks, Betty.
Bye-bye. If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.